Ayurvedic fraternity from India across the globe. I wish to reverberate the words of Dr. Mathai. He said that integrative medicine is happening. Just 2 days back, I came back from Berlin, where the third European Congress on Integrative Medicine was held. And it was very interesting to know, every year we are attending that, and this is the third year, and the visibility of Ayurveda is increasing very much. And thanks to this time, particularly Ayush participated. The DG of CCRS was also there in the plenary session to deliver a talk. But one interesting thing that we noted there was particularly the doctors there in the West, Europe, as well as in the various universities of America, were also asking for what is known as this evidence base. This evidence base, and one of the, in fact, to quote, is one of the famous professor of neurology from the Charité Medical University of Berlin. He expressed that he visits India every year, and he is today coming to India, probably, maybe, not Elvin? Okay. He is coming to India today. I don't know whether he was able to participate in this World Congress. And he comes to India only to observe these Ayurvedic therapies, particularly in the neurological disorders that Dr. Acharya was talking about. He's looking for the answers, particularly in these areas. And that's what is happening around the world, and what they want us is this, the evidence base. When we talk about an evidence base, in my just next 5 minutes, I'll just take you through this, the short understanding of this, and later give you those systematic reviews that has happened in Ayurveda, as well as that we have done it in Himalaya. This practice of EBM, always everyone was looking at the clinical studies. Give me the evidence in the clinical study, large trials and so on and so forth, as it is defined, individual clinical experience plus best available external clinical evidence from the organized trials, as well as patients' values and expectations. So all three together, so we have probably a lot of data available. And this is not only for a medical practice individually as a physician, but most importantly also as the governance was talking about, how this evidence based to public health is concerned, is also very, very essential and important. There is a need for research synthesis together. Everyone is looking at RCT group, but if you look at this, that to keep update in medicine, particularly internal medicine, one needs to read 7 articles a day and 365 days a year. And I'm sure everyone will agree that we don't have sufficient time to go through that. So what is the easiest way and the most the scientific way of getting this knowledge is the so-called the systematic reviews, as well as clinical practice guidelines, which is coming out around the world, and that makes physician more competent and confident as well. This bringing out a research synthesis, this was the person almost more than 100 years ago. Carl Pearson was the first medical researcher who chose the formal techniques to combine data from different studies. So many experience. There are many physicians, thousands and millions of Ayurvedic physicians in the country, and their experiences, collected together into a systematic review to offer. So I don't know. I don't think that anybody in the world would ever reject it. As you know very well, one of the important database, which is very famous all around the world, the Cochrane, and was attributed to this British researcher. You see how he expressed, it is surely a great criticism of our profession that we have not organized a critical summary by swinging out on this, the systematic reviews, meta-analysis, and decision-making, and cost-effectiveness that one of the speakers was talking about, very importantly, I think Mr. Naik was talking about. How do we analyze this cost-effectiveness out of an experience, maybe it's a clinical experience as well as a clinical study organized as well. So there are many literature available to us today as a guidelines. And there are even, as you have seen here, the American College of Physicians Journal Club, bringing out a journal exclusively as evidence-based medicine itself. Is a great example, and one that has come out now out of this ECIM activities in Germany is Elsevier publication, the European Journal of Integrative Medicine, which is now available online as well. There are a lot of data being added into this. There are CD bases. The evidence base, are they different? If you look traditional narrative review, everyone, traditionally used to say, I had a patient, I diagnosed like this, and then I treated. This was the result. That's a traditional narrative review. Then systematic review, over review, meta-analysis, pooled analysis are the tools that we have today to talk about the scientific application for this. And if you look, all the reviews put together, the individual patient data meta-analysis parts the crux of the whole thing, which gives essence of the whole evidence that whether it works or not. You see this, some of the elements of the systematic review, if you look, formulate a review question, write a protocol, search for primary studies, extract data, analyze data, and then present it. But was that how this meta-analysis have an advantage over the so-called large clinical trials? If you look very well, the confidence level of a meta-analysis is much more greater, that the evidence is much more confirmed rather than even clinical trials by themselves. And was this evidence base available in Ayurveda? If you look, the Charaka was always talking about when you want to choose a data or a document or a literature. It was brought out by the Healthcare Research and Quality of the US in 2001. If you look, there are 54 articles they have containing results of 62 clinical trials they have reviewed here. And exclusively, primarily, not entire Ayurvedic therapy, but primarily herbal therapy. And out of these 54 articles, 52 of them focus either on a single herbs or a herbal formula, while the remaining 2 articles focus on primarily on diet. And although some of the Indian studies included Ayurvedic terms, these studies focus exclusively on Western diagnostic criteria and outcomes. And these are the outcomes that came out: Gymnema sylvester, Coccinea indica, fenugreek, Eugenia jambalana. Besides, the combinations of Ayush 82 and D400, the Diabicon that Himalaya brought out, were the 2 most often studied in these studies. And out of the 35 studies included in the comprehensive review from the Western literature, 27 came from Indian literature itself. And they were categorized, randomized, controlled trials, and so on and so forth. Finally, the evidence is to suggest that single herbs like Coccinea indica, holy basil, or this, tulsi, as we say, fenugreek, Gymnema sylvester, and these combinations deserve further study, as they showed glucose lowering effect. And evidence for the other herbs which were commonly seen, jambalana and Momordica chirenchia, was very low in this. And conclusion, there is a great heterogeneity of the available literatures on Ayurvedic treatment for diabetes, and overwhelming majority of the studies test herbal therapy than a system therapy, as we see the whole thing as a program. And the heterogeneity exists in the herbs and herbal formula tested as well. Finally, they say the shortcomings they identified, and there are, despite limitation, there is sufficient data for several herbs or herbal formulas to warrant further studies. Similarly, as it is very well known, our product Li52, which almost stood amongst the top 5 pharma drugs for the last 2 years, underwent meta-analysis of 50 phase trials for the last 40 years. And the outcome was published in this medicine update. And it was classified and have an evidence of these 50 trials, selected ones, particularly for this meta-analysis, fulfilling all that criteria that was put into a question. And then it showed a lot of benefit and advantages, for which reason that it was actually the only Indian herbal Ayurvedic therapy listed in the Bible of the top products around the world, called the Martindale's drug reference around the world, the only one product that was referred there, probably because of these evidence that it has. And I thank the organizers for giving me this opportunity. And this method, meta-analysis, which is looked by the world today, have great evidence that offers the Ayurveda still works. Thank you.